What is assistive technology? Assistive technology, or AT for short, is any device or service that helps a student to meet his or her IEP goals and to better participate in the most appropriate classroom setting. When effectively integrated into the general education classroom, AT can provide students with different ways to complete their work and actively participate in their education. What forms does AT take? The Individuals with Disabilities Education Improvement Act of 2004, also referred to as IDEA, mandates that public school districts must ensure that assistive technology devices or assistive technology services, or both, are made available to a child with a disability if required as part of the child's IEP or 504 plan. AT falls into two main categories: devices and services. Assistive technology devices. IDEA defines a device as any item, piece of equipment, or product system that is used to increase, maintain, or improve the functional capabilities of a child, and specifically excludes a medical device that is surgically implanted or the replacement of such a device. In other words, if a child needed a pencil grip to better enable the child to participate in writing tasks, this would fall under the auspices of IDEA legislation. Similarly, if a child was hearing impaired and needed for the room and teacher to be equipped with an FM amplification device, this too would be covered. However, a cochlear implant would not be covered, since it is a surgically implanted medical device. There are many types of devices. Devices that help with hearing impairment, visual impairment, learning disabilities, and more. The girl in the image on the right is utilizing a wheelchair, which would be considered a mobility device. Mounted on her wheelchair is a communication device, which can aid in receptive and expressive language. However, devices do not need to be expensive or high-tech, as illustrated in the picture at the bottom. A simple pencil grip can assist a student who may have an immature grasp pattern, low muscle tone, or poor hand strength and endurance. Assistive technology services. Likewise, IDEA defines services as any service that directly assists a child with a disability in the selection, acquisition, or use of an assistive technology device. Assistive technology supports and services that are specified in the federal definition of assistive technology services include evaluating the student's need for a device, buying, leasing, or acquiring the device, selecting, fitting, adapting, repairing, or replacing the device as needed, coordinating the services for a student who uses a device, providing training or technical assistance to the student, family, teachers, or others involved in the use of the device. Devices and services go hand in hand because success for a student is dependent upon not only having a device, but also on having the support and services needed to use it effectively. How can assistive technology help? Students may benefit from AT to help them communicate, perform academic tasks including answering questions, completing assignments, or doing homework, participate in extracurricular activities such as band, chorus, or even sports, travel throughout the school, better enabling a student to travel throughout the property in a safe and timely manner, use proper seating or positioning, and an overall greater access and comprehension of academic materials and content. But it is equally important to remember that having an AT tool is not the same as being able to use it. Very often, in order for a device to be most effective, training of the student, and the parents when appropriate, is a vital component of the effective implementation of assistive technology. AT in OT. The primary role of an occupational therapist is to help a person gain independence and improve participation in activities that occupy their time. This may be functional tasks, such as getting dressed or eating a meal, but it also includes helping a person develop the skills necessary to participate in various areas of occupation, which for a child is primarily education and play. So the question becomes, how is assistive technology put into practice within the domain of occupational therapy? Physical adaptations to improve a child's ability to complete a task successfully. This may include adapted pens or specialized grips for a child with low muscle tone, poor endurance, or a weak grasp to assist a child with holding a writing implement in a functional manner. Or it could come in the form of specialized seating devices for a child with poor core strength or atypical muscle tone throughout the torso. Specialized learning tools to help a child learn information in a different manner or medium. For example, it could be a more complex, computer-based activity to help a child maintain attention and remain motivated to complete math or reading-based activities. Or it could be a more simple activity, such as forming letters out of Play-Doh, to encourage a child to experience the process of forming letters in a correct fashion, to reinforce the neurologically centered aspects of understanding and remembering how to properly form a letter by using a hands-on and tactile approach versus the traditional paper and pencil. Ergonomics to better enable a child to remain comfortable in the classroom environment. Since children come in all different sizes, but very often classroom desks, chairs, and computer stations are a standard, uniform size, not all children will be able to sit properly, comfortably, or even safely in a traditional classroom desk or chair. For some students, this additional discomfort may prevent them from being able to focus and attend to academic content within the learning environment. An occupational therapist can assess a student for proper seating and positioning, making recommendations or adjustments as needed. Sensory adaptations to improve a student's ability to pay attention in the classroom. Some students are unable to adequately filter extraneous stimuli within their environment. At best, this is an annoying distraction, but at worst, experiencing an overload from noxious stimuli can result in a child being unable to think or even properly function. Some children find the noise of a chair scraping across the linoleum floor to be physically painful, or the flickering of an ultraviolet light bulb to be agonizing. Some simple solutions may include covering the bottoms of classroom chairs to reduce the noise in the room, or placing special covers over light fixtures. Other children may struggle to sit still for extended periods of time, but placing pieces of scratchy Velcro on the side of a desk may provide adequate tactile input, which in turn may enable a child to remain seated and focused for a longer duration. Final points to consider. Regardless of how AT is incorporated, it is important to keep a few things in mind. First of all, the earlier students are introduced to AT, the sooner they master it. Once mastery occurs, the child is then better able to focus his or her attention on content and learning. Second, AT can increase a child's independence, allowing students to access material, be more participatory, and demonstrate their knowledge. Finally, for some children, assistive technology can make all the difference between ignorance and learning, isolation and participation, failure and success. Thank you for taking the time to listen to this module on assistive technology and how it relates to classroom learning and occupational therapy. A list of resources is contained below.